February is National Heart Health Month, and many people are working to spread awareness of the #1 killer in women, heart disease. According to the American Heart Association, it causes 1 in 3 deaths every year. That's about 1 woman every minute. ABC 2 News' Chanel Pearman has more on what you should be doing to make sure that your heart isn't just happy on this Valentine's Day, but that it's also healthy.
Keeping a healthy heart is something 50-year-old Kim Winder has been mindful of her entire life, especially since it impacted her life at an early age.
When I was a little girl, I was diagnosed with a heart murmur.
Growing up, she took the necessary steps to stay healthy. As an adult, she says she felt fine. That was until she didn't.
It was a gripping pain. It was one of those types of pains that would come significantly, grab you, kind of get a hold on you, and then it would just go away.
Winder didn't quite know what was wrong, but she did know something wasn't right, a common factor for many women.
One thing which is very common is that I know that they know something is wrong but can never sort of pin it down.
Dr. MedStar with MedStar Hospital has spent years working with women with heart disease. She knows firsthand how difficult it can be for women to know something is wrong.
And the symptoms can range from feeling tired to not feeling right, to having a fluttering sensation in the chest or feeling short of breath.
Thankfully, Winder acted quickly. She discovered she had other heart issues outside of her heart murmur.
That was very scary for me, so I didn't want to play any games.
Dr. MedStar stresses the importance of women knowing their bodies and thinking of heart health.
It's not too early to start when you're in your 20s. That's when it's, I think, important to establish your baseline and know your numbers in terms of your blood pressure and your cholesterol, also your BMI, focus on that, and then try to establish good eating habits.
Once you've established a good foundation in your 20s, Dr. MedStar says you should be mindful of stress in your 30s.
When you're in your 30s, I feel that most people, have a job, they have a family, so, stress, which is, I think, really part and parcel of our lives, and stress plays a very important role.
She recommends exercising and staying active to help balance stress.
If it becomes a way of life, then chances are that you'll stay like that.
As you get older, these are things you should continue to keep in mind. Knowing your numbers, having good eating habits, staying active, and of course, if you feel like anything is wrong, go get checked out.
I appreciate when patients do come forward, with vague symptoms, and then, we can go over their history and risk factor stratification and try to figure out what's wrong.
After being proactive and catching her heart issues early, Winder says she's doing well.
I was determined to make sure that I would be healthy, that I would follow the advice of my physician, and that we would collaborate and make this a team effort so that I could live a healthy life.
Just because you feel fine doesn't mean you aren't at risk for heart disease. If you feel like something is wrong, even if you can't pinpoint exactly